Welcome back to my channel and welcome back to Coffee Talk, where I take an interesting topic and give it to you in the time that it takes to drink a cup of coffee. So, grab yourself a cup of coffee, make sure that it is piping hot, add yourself a little creamer. My favorite is French vanilla. And if coffee is not what you do, perhaps a nice herbal tea is more you. Make sure that that tea is steeped to perfection and add a dash of honey or agave. My favorite tea is lavender tea. And if coffee or tea are not what you do, perhaps a fruity smoothie is more for you. And let's get into today's hot topic, which is understanding infertility issues among Black American women. So now let's get into today's hot topic. Infertility affects millions of people in the United States, but Black American women experience disproportionately higher rates compared to white women. Studies suggest that Black women are nearly twice as likely to struggle with infertility, yet they are less likely to seek or receive treatment. Several factors contribute to this disparity, including systemic racism, socioeconomic barriers, underlying health conditions, and lack of access to reproductive health care. Some of the key factors contributing to infertility in Black women are higher prevalence of fibroids. Uterine fibroids, non-cancerous growths in the uterus, are a leading cause of infertility and miscarriages. Black women are 3 times more likely to develop fibroids than white women, and they often experience them at a younger age and with greater severity. Fibroids can distort the uterus, block fallopian tubes, and disrupt implantation. Polycystic ovary syndrome, PCOS, and endometriosis. Black women are also more likely to suffer from PCOS and endometriosis, 2 conditions linked to infertility. PCOS causes hormonal imbalances that interfere with ovulation, while endometriosis leads to painful scar tissue that can damage reproductive organs. Despite their prevalence, these conditions are often underdiagnosed in Black women due to racial bias in healthcare. Chronic stress and racial trauma. Chronic stress from systemic racism, discrimination, and economic hardship can negatively impact reproductive health. Elevated cortisol levels disrupt hormonal balance, leading to irregular menstrual cycles and reduced fertility. Studies show that Black women experience weathering, where prolonged stress accelerates biological aging, increasing risk for infertility and pregnancy complications. Lack of access to fertility care. Black women face significant barriers to fertility treatments like IVF, in vitro fertilization, and IUI, intrauterine insemination. Some factors that are included are high costs. Fertility treatments are rarely covered by insurance for Black women. Medical mistrust due to historical abuses like the Tuskegee syphilis study. Underrepresentation in fertility clinics. Many Black women report feeling dismissed or unheard by doctors. Higher rates of STIs and pelvic inflammatory disease, PID. Untreated sexually transmitted infections, STIs, such as chlamydia and gonorrhea, can lead to PID, which causes scarring in the reproductive tract. Black women have higher STI rates due to disparities in sexual healthcare access, increasing infertility risks. Environmental and chemical exposures. Black women are more exposed to endocrine disrupting chemicals in hair products and pollution in low-income neighborhoods. This affects ovarian reserve. Obesity and metabolic syndromes. Black women have higher obesity rates, which are linked to insulin-resistant PCOS and lower success rates in IVF. What can be done? To address these disparities, solutions include expanding insurance coverage for fertility treatments, increasing Black representation in reproductive health care, improving early diagnosis of fibroids, PCOS, and endometriosis, and providing culturally competent care to reduce medical bias. Black women face a complex web of biological, social, and economic factors that contribute to infertility. Addressing these issues requires systemic changes in healthcare policies, increased research on racial disparity in reproductive health, and better support for Black women navigating fertility challenges. By raising awareness and advocating for equitable health care, we can help reduce infertility disparity for Black women. Now I have come to the end of today's coffee talk, and I hope that this discussion in regards to infertility in Black women has been interesting and helpful for you guys. I will leave my resources in the description of this video. If you're not already subscribed to my channel, what are you waiting for? Please go ahead and subscribe to my channel so that you're notified of everything that I have coming up. In the meantime, I'm going to drink myself another cup of coffee and start working on the next video for you guys. I would love it if you would also go ahead and follow me on my other social media. You can catch me on TikTok and Instagram as DC The Purple Diva, and on my other YouTube channel, The Purple Diva Den, where I do spoken word. I'll see you guys in that next one. Peace and blessings from the West Side. I'm out. Bye.